Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, attorney Kim Hegwood with Hegwood Law Group, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens. And today are with me, Kim Hegwood. Sorry about that. And with our very special guest today, Lisa Milliken, and welcome to the show.
Thanks. Glad to
And
be here.
and your company is Milliken Healthcare Consulting. Is that correct?
Yes, I'm an independent contractor, so I work for 5 or 6 different people, and it all goes through Milliken Healthcare.
Perfect. And so today we're going to be talking about the understanding the benefits and risk of medications. And one thing we find in my practice is that some of our clients are on a lot of medications. And so, and what I found in my own personal experience was the doctors, they don't know enough about medications to know when they start prescribing a bunch of them, how they act. And so would you do me a favor and kind of walk our listeners through examples of a drug-to-drug interaction?
Yes. So, and one of the issues you've mentioned about doctors is sometimes each doctor may very well know about the one they're prescribing, but a patient or client may often have different specialists who are not aware of all the other medications that another doctor's prescribed. And because they're asking you, tell me everything you take, and you forgot a few of them or you didn't think they were important because they're not for that specific, like they're not for heart disease, so you don't tell the cardiologist about the other meds you're taking. So drug-to-drug interaction is when one drug amplifies or depletes the ability of another drug to happen. So have lots of examples. If you look it up, I just Googled it, thought if anybody Googled it, what would they see? And the example is that often comes up is if you take a nasal decongestant and a heart medication, so those two can interact to elevate your blood pressure. And so a lot of times we don't even think about those over-the-counter medications. Mm-hmm. Another example is that I see a lot because I work with older people in a lot of different settings in home health, in nursing homes, in hospitals, in clinics. If a patient is given a medication for pain and they also have gastrointestinal problems and they end up having diarrhea. Now, diarrhea and nausea and vomiting are some of the highest adverse effects of another medication. So if you also take, say, a medication to stop the diarrhea, well, that's going to work against the medication for pain meds, and you're going to be constipated for days, and that's going to cause a lot of pain, a lot of abdominal pain, a lot of problems with your entire system. And then there's just so many medications for heart disease that interact with medications for diabetes. And an example of that, I had a patient who they thought she had dementia and she stopped eating. And first of all, a lot of people get diagnosed with dementia and it's not dementia, it's something else. Turned out she couldn't speak English. So that's why she wasn't responding. She was from the Middle East. Her son told me, and she spoke Farsi or something, but nobody knew that. Anyway, she was taking 2 medications to include a beta blocker. I think it was metoprolol or corvedolol. Anything that ends in -olol is a beta blocker, which is supposed to slow your, decrease your blood pressure and take the pressure off the heart, and she kept getting sent back to the hospital from the nursing home for high blood glucose levels. So her glucose levels would go so high, her sugar levels, that they'd have to send her out. And she was also taking a medication, a statin for high cholesterol. So the statin was increasing her, decreasing her appetite, or as the research says, increasing the risk of anorexia. So that was causing her not to eat. They were blaming it on what they called was dementia. And the beta blocker, metoprolol, corvedolol, whatever it was was triggering high blood glucose levels. Tramadol is a pain medicine that also triggers high blood glucose levels. So we have to be so cautious. And then, so I started talking with the nurse practitioner and the pharmacist. Those people are highly important. And I'm a strong advocate of the interprofessional team, that we're all working together and sharing information and say, hey, come look at this. And it turned out that she really didn't even need the beta blocker. She needed that when she weighed 100 pounds more 10 years ago. She's 92 years old now, and she's never had a heart attack. She does not have hypertension anymore. She didn't even need the one that caused the low blood sugar, and the one that, she didn't need the one that was a statin. She didn't need that anymore. A lot of doctors will say after 75, you may not need that, but don't stop taking it. Always check with your doctor. And then she didn't need the other one either. So both of those ended up being deprescribed, and she was better. But the research says if you're taking more than 5 medications, you have a very high risk of a drug to drug interaction, and it amplifies from there. If you've taken like 8 or 9, you have a much higher risk. It's like 100% chance of a drug to drug interaction. So I always want to say, first of all, I'm not a pharmacist. I've just worked on healthcare teams for 35 years. It's very important that if you see, any weird symptoms or any of your vitals are being elevated, always, you can go back to your doctor if you have an appointment, but you can just talk to the pharmacist, say, hey, should I be doing this? So there's a lot of risk, and I could talk about that for the next 2 hours, but I'll let you ask me what else you want to ask me.
Well, we tell clients a lot, go back to the pharmacist, take every one of your meds, set them down, have them go through, because I'm like you, I have a JD, not an MD, but you see a lot of clients, and you really learn a lot from, I learned a lot, I learned that you read those little white papers that the pharmacists give you. Because, my grandfather's doctor had prescribed him, can't remember what it was, to help him sleep. And if you'd read the little white paper, it says, don't give to the elderly. The pharmacist never should have filled it, because he was crazy for 2 days, and so, so I realized right then that I was responsible for making sure that all the drugs did what they were supposed to, didn't do what they were supposed to, and and really had to stay on that a whole lot more. So we tell clients, go back to the pharmacist. They're trained to know all these things, and so that's good advice. I appreciate that. So what kind of symptoms do you see that should be reported to the doctor when you start taking new medications?
Well, like I said, the most common ones are any GI related symptoms, nausea, vomiting, diarrhea, upset stomach, lack of appetite, those kinds of things. One of the critical ones to report is if you have a change in vitals. So that's one of the most common, another very, very common adverse effect is hypotension. That means if your blood pressure goes too low, and it can also go too high as an adverse effect. But if it goes too low, sometimes you don't realize, and some people don't realize, if it's low, I should report it. They only think they should call the doctor if it gets high, because they think, oh no, stroke, heart attack. But low can be very risky. An example is, if you're taking blood pressure medications or diabetes medications or kidney medications or diuretics, any of those can make you have what's called orthostatic hypotension. And all that means is when you change positions by standing up, your blood pressure drops severely, and by like 20 or 30 points for the first 30 to 60 seconds. So you have to keep standing up, hang on to something, just stand there, maybe count to 10 until you're not dizzy anymore, and then start walking. But people stand up and they start walking and they fall and they hit their head. And that's a common reason for emergency visits and head trauma, even, severe head injury. They hit the corner of the furniture. That's very, very risky. And it's so common if you're taking this medication. So always report that. Then there's the obvious things like rash. Like if I see this rash, what's that? I mean, that could be from an antibiotic, from, any kind. And there's a lot of risk of antibiotics. So, don't think, oh, this one's safe, it's going to help me with my infection. And I always tell people, if you're sick and you have a fever and you go to the doctor, please don't get mad at them if they do not give you an antibiotic, because now they have to run all these tests to make sure that it's bacterial and not viral. Because if you take an antibiotic frequently, then you can develop these superbugs that it's called. You can develop internal bacteria that there's no antibiotic to fight. And so anyway, we only need antibiotics when we really need them, but they also have a lot of side effects. And if you're breaking out into a rash, you want to stop that immediately and call the doctor and say, you can get to their nurse usually. And they'll say, okay, you need to stop taking that right now. Drink a lot of water. We're going to prescribe a different one to you. So don't just think, it's just a little rash, because that's just an outward sign of something internally that's happening. So those are very high risk.
So a lot of people are very much into homeopathic remedies. They're trying to get off the medications. They're trying to do other things, more natural types of, medicines. And so what are the risks for people who are taking those?
This is such a huge topic. And this is one you can Google, but I'll just give you some examples. There's some herbal supplements that may be very helpful to keep you well if you're not taking any other medications. So they are also a medication, but they're not FDA regulated. Some may be very strong, some may not be strong at all, because they're not regulated. I see this with a lot of my home health patients, that they're, I'm also taking this or I'm taking that. Almost all of the herbals, when I look them up, I just printed like a 3-page list of herbal supplements that interact with medications. Almost all of them should not be taken with a blood thinner, like warfarin, or any of the new ones that have come out, warfarin, Coumadin, whatever you call it, because they increase the risk of hemorrhage. They have more, for instance, I see a lot of things on TV. Oh, take this and it helps your brain function. Well, that may be thinning your blood to help increase circulation in your brain if you're not taking any other medications. But a lot of times the reason we have cognitive deficits, and I treat a lot of these people, is interactions of medications causes cognitive impairment, which gets diagnosed as dementia. And it's not dementia, it's because you're taking these medications, probably kind of like the ones you were mentioning about your grandfather or somebody, because as we age, and this is a kind of a separate topic but directly related, we have decreased kidney and liver function. Starting when we're in our 20s, we start to lose about 1% a year of our kidney and liver. It's okay, you could still have a good kidney and liver until you're 110, because you also decrease a little bit of muscle mass and all of that. But the two things you can do to hurt your kidneys and liver, one, when the aging process, let's say when you're 80, you have 50% of what you had when you were 30, right? You have a smaller, more compact, hard liver. Your kidneys are working at about 50% of capacity. The two things that you can further stress your kidney and liver is to take medication, which puts an extra toll on preservatives and alcohol and coffee, caffeine. All these things are pulling from your kidneys and fighting for the function it has left. Well, medication's one of the worst things. So the more meds do, the more you're overloading your kidneys. And then meds are fat soluble and water soluble. So as we get older, not that we're gaining weight, but we may just naturally have less and less muscle mass. And so we have a little bit more and more fat mass. So fat soluble meds like Xanax, Ativan, a lot of antidepressants, anti-anxieties, sedatives, narcotics, they're fat soluble, so they're more concentrated and they stay in your body longer and they're not being excreted out. So anyway, a lot of, I'll give you some examples. Coenzyme Q10 that people think, oh, that's good for your heart. It directly works against the effectiveness of warfarin, and your blood pressure will be affected by coenzyme Q10 if you also take a calcium channel blocker. Danshin is one I had not heard of. It interacts with anticoagulants and the calcium channel blockers, which we take to, decrease our blood pressure. And it interacts with digoxin. Evening primrose interacts with aspirin, warfarin, all of those blood thinners. Garlic, this is when I have a lot of home health patients say, oh, I take garlic pills, or I crush garlic and take it with olive oil. That one increases your risk of hemorrhaging if you're taking aspirin or warfarin or any of the blood thinners. So there's a lot, ginseng, hawthorn, licorice, saw palmetto, and then St. John's wort interacts with lots and lots of medication. So my point is, if you think, oh, I'll just grab this and I think this will help my cognitive function or my body work better for whatever reason, ask your pharmacist. And mention it when you go to the doctor's office. And some doctors will get very angry. I didn't tell you to take that. Why'd you take that? And then it makes us feel bad. We're just trying to be helpful. We're just trying to be healthy. I read it in a magazine and it said it was good for me. But they'll get very angry with you because you just greatly increased your risk of a heart attack or a stroke. So always ask.
So what about antipsychotics?
So antipsychotics are a very good medication necessary if you have schizophrenia, bipolar disorder, psychosis, or major depression, not regular depression, major depression that causes you to completely shut down. They are not meant to be taken just for sedation or for what is called behaviors. They're not meant to be taken with dementia. They can increase your risk of death quickly within a few months if they are given with dementia, and yet they're given all the time off-label, off-market, because it helps them to calm down is what they think, but it really shuts down your motor system. So like I work with a lot of swallowing disorders, it completely makes it almost impossible to swallow if you're taking an antipsychotic. It changes I've got clients who are in their 30s who are taking antipsychotics, for epilepsy, which is really off market. And everybody of every age, their walking becomes very difficult and they become very rigid. Their body can't move very well. And then when they're coming down from the medication, they're not ready for the next dose. They have even more agitation and behaviors. So people think it's good. It helped her to calm down, but it's really very, very dangerous. They have the longest list of side effects that are very dangerous. And yet, if you have a mental illness, such as a schizophrenia or bipolar, they can be very helpful, but they were never meant to take them for other diagnoses. So they're quite dangerous. And yet a lot of physicians are not aware of all the dangers. If you're in a nursing home, it's actually illegal to prescribe them unless you've tried every other option first. So I teach a lot about that. We have to figure out what triggered what you're calling the behavior. I'm really calling it, they're trying to communicate and they don't have the words to do so. So they may try to hit you if you come too close to them, or they may scream, or they may rock, or they may have all of these behaviors or start just pacing very quickly. It's because they can't tell you I'm cold, or I have to go to the bathroom, or I'm hungry, or I'm fearful, I don't recognize you. So we have to figure out, why are they upset? What started the agitation? If we figure that out, we can solve that problem. Or I'm in pain. Maybe they need some acetaminophen, that is Tylenol. And we can address that rather than just sedating them and shutting them down, their motor system. We think we're calming them, but we're not. We're really shutting their body down.
Yeah. So Lisa, how does someone find you if they want to get some more information or hire you?
The best way is to email me, and that's L Milliken, MILLIKEN 2021, just like our year, @gmail.com. They could also call me, but I'm often with clients or in meetings or on Zoom calls or doing this teaching. I teach about 60% of the time, and I treat clients about 40% of the time. So it's kind of hard. I mean, if they email me, it's a good time. I'll set up a time to call them. So that's best.
So, but if they want to leave a message, what's the number?
Yes. Oh, okay. 346-334-8777.
Perfect. And so, well, this has been really informative. And so I just wanted to thank you so much for being on the show, because I learned a lot today. And so
Right. There's so much more.
yes, and we'll probably have you back to talk about some more things. And so, and I appreciate it immensely. And so thanks so much.
Thank you.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.